What's up, folks? Jaquel Wimbush here, your host of Back to the Basics of Health and Wellness Podcast. On today's show, I'll be talking to Dr. Jeannette Musset, aka Dr. Wellness Scottsdale. She's a naturopathic doctor, and we'll be talking about how she got into it, what she's doing, and where she's going. Let's get into it, guys. You always pass failure on your way to success. Mickey Rooney.
Daddy, it's time to start your podcast.
Hey, Dr. Jeannette, hope all is well. Welcome to the podcast.
Oh, I'm great. Thank you so much for inviting me.
You're very welcome. You're very welcome. This has been in the making. So we finally are here to get it done.
Yes.
So
finally.
Yes. So Dr. Jeannette, what made you become a naturopathic doctor?
So that's a good question. So I grew up in Rwanda, Africa, and
Nice.
my mom was always making things at home, in the kitchen, let's say for coughing or sneezing or, something going on.
Okay.
So I kind of knew that, natural, sometimes you can use natural medicine to help what's going on. And obviously, yes, we did go to the hospitals, we did see, the conventional doctors, but I kind of knew that, you can use both,
Mm-hmm.
But I didn't know that you can actually study natural medicine until I moved here to the States. And then I did a lot of scientific research.
Okay.
And then I met, other students, and then we're just talking, back and forth. And then obviously, I kept in touch with them. And so one of them ended up going to a naturopathic school. So then she told me, oh, yeah, I got into naturopathic school. I'm like, oh, my gosh, what is that? And then I Googled. I was like, oh, ta-da! That's what I've been, that just makes sense,
Absolutely.
So to me, it was just exciting that I could actually learn how to use that and help people, use, as, natural medicine as possible.
Mm-hmm.
Also being scientifically, educated, so that really made sense to me. So it wasn't a choice whether conventional or natural. It just, because I've seen it work with my family,
Absolutely.
so yeah, so
Beautiful.
it made sense.
Beautiful. What school did you go to? Did you attend?
So I went to the SENM in Tempe, Arizona.
Okay.
And yeah, that's why my practice is actually here in Arizona. So after school, I decided that I'm going to open my practice. And I actually decided in my second year of medical school, I knew that I wanted to be my own boss. I also knew that, just going through the clinical rotations, I saw some things that I didn't quite like in terms of people with, from different backgrounds,
Mm-hmm.
and how, either students or the other doctors didn't quite take into consideration their upbringing,
Okay.
their culture, their, the foods that they eat at home. So I knew that if I open my own practice, I'm going to be able to really help patients in a different way, taking into considerations, their family, where they come from, the food, family dynamics, those kind of things. And it has helped a lot because I get people traveling 3 hours to see me because they just, feel like they're, they more connected with me. Like
Wow.
I actually get them. Like
Yeah.
I understand without being judgmental, that I actually get, what they're feeling and, and what they actually want to achieve with their
Absolutely.
health.
That's beautiful,
Hmm.
beautiful. Especially when people want to come travel to visit you. That's a beautiful thing, and
Yeah.
that
Thank
shows
you.
that you are doing the work and helping people, and for them to want to take that ride is a beautiful, beautiful
Yeah.
thing.
Yeah.
Can I
Thank you.
backtrack for 1 second? You say you was from Rwanda. How was it
Hmm.
growing up in Rwanda? Because for us Americans, we've
Hmm.
seen movies and things like that that depicted the civil wars and things like that going on. How
Hmm.
was it when you were living there?
Um, it was, it wasn't pleasant. And, obviously there are a lot of things going on and, people fighting here and there, so, but, um, you just keep, you know, positive
Hmm.
and you just take one day at a time,
Okay.
so, um, yeah, that wasn't the greatest, but, you can always find something positive to be thankful for, so, but Rwanda now is good,
Hmm.
it's beautiful. People are very nice, very welcoming. The food is amazing. The culture is, you know, really nice. People are very clean,
Okay.
so yeah, Rwanda is doing amazing now,
Good.
and
Beautiful to
people
hear.
should check it out.
Yes, absolutely, absolutely. And I would definitely like to visit Africa soon, as soon as
Hmm.
this COVID stuff gets out the
Right,
way and we
right,
can all get around and move around like we used to. All right,
right,
cool, cool.
right.
Thanks for answering that question. I appreciate it. So
Yeah, I take care of them.
nice, nice, nice.
Hmm.
What are you seeing right now as far as with hormones? With a lot of people having too much of a certain hormone. Like, what are you seeing in your office?
Oh, yeah, that's a good question. So, I guess because of the pandemic and, what's going on, so
Mhm.
I see a lot of people are stressed. So I see their cortisol, um, you know, either really high or really low.
Okay.
Um, and then obviously, um, trouble sleeping, weight gain, so yeah, a lot of um, those things.
Okay.
Um, yeah.
And when it comes to cortisol levels and stress, can people get tested for their hormone levels? I get that question a lot, but I want you to answer it for me
Hmm.
as a doctor.
Oh, yeah, 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 yeah. So it's and yeah, that's a good question. So you want to make sure that whoever you are working with, a doctor actually, they know what they're doing.
Hmm.
So yeah, so there are specific hormones that I run for my patients. So it kind of gives me like a big picture on what's going on versus just cutting corners and especially with thyroid,
Yes. Hmm.
you see that some doctors just check TSH,
Hmm.
which is just one component of the thyroid hormone, but there is more to that than just TSH. There's the T3, T4, 3T3, 3T4. And then I also check the antibodies because sometimes you can have all the levels that are really good, but you have antibodies that are attacking the thyroid, um, so that's something that I look at, and most often it's due to gluten.
Hmm.
So if your doctor is not asking you what you're eating, um, you know, they're missing out on a lot of information.
Yes, they are.
Hmm.
And the difference between yourself and an MD, like if somebody could go into a medical doctor's office, a MD's office, and say, I think my hormones are off.
Hmm.
Like for yourself, you
Hmm.
go straight in and say, I think you need to go get your hormones tested, correct?
Okay, so between the big difference between me as a naturopathic doctor versus or MD colleagues is that my approach is I want to look at the whole person, so meaning that we're going to talk about your sleep, we're going to talk about where you're eating, your stress level, your emotional component, what's going on at home. So I usually really spend a lot of time with patients. So patients come to see me, we joke around, in my clinic that you're going to wait 5 minutes in the lobby, but then you're going to see me for an hour, where when you go to our colleagues, you might just wait an hour and then see the doctor for 5 minutes.
Okay.
So I feel like when you have enough time with patients, you actually get to dig deeper. So sometimes by what the patient is telling me, either by what they're eating or what they're putting on their skin, like a lot of like products,
yes,
they can interfere with your hormones. Also emotionally, I'm looking at, not only what they're saying, but their facial expressions, so they're, as a naturopathic doctor, we really dig deeper, with, looking at a lot of different things. And then from there, once I meet with the patient, then I decide which way we're going to go, as far as ordering hormones, so,
okay.
So it's very individualized, which I really like. So every patient in my practice gets an individualized care. It's really tailored to them. So, and that's why they do really well, because
Nice.
we're just not guessing, we're not cutting corners, and then I do follow up with labs, so they can kind of see once we introduce whether it could be hormonal replacement, whether it could be herbs, whether it could be some vitamins and minerals. We have patients can see from where we started to where we are.
Absolutely. Yeah, because I get people. Some of my clients, they say, "Oh, I went to the doctor and I asked them if they can run if what to run a hormone panel on me," and they say, "Oh, we don't do that unless we see that you need to have a hormone panel run." So that is good that naturopathic doctors like yourself will just look at the patient overall from their movements, their everything, to figure out you need to go for hormonal labs. So that's very good, very very pleasing to hear. The other thing is when it comes to hormones, with young boys, with testosterone, as far as me being a man, with testosterone being in play, at what age do boys start to lose their testosterone?
So typically we see that in your 40s, maybe.
Okay.
40s. Yeah. So most people under 40 are, they're pretty good. But yes, there is an exception, especially if people are not eating, right. So that's also part of things that I help with my patients. So nutrition is huge, huge when it comes to your overall health, including testosterone, and then also exercising. Exercising is good to raise your testosterone. Yeah, but typically I see it in the 40s and 50s.
Okay. All right. So exercise does play a huge role. Eating plays a huge role. What about the how can I say, where we at today with estrogen playing a role in our food? Is that showing any signs that it's wreaking havoc on younger males?
Oh my gosh. That's an interesting question. There's definitely a trend where we're seeing, especially with the plastic, the plastic containers or plastic bottles. Those are like endocrine disruptors,
Yes.
so meaning that they're going to kind of mess with your hormones. So, yes, so we are saying that, but there's so much more than that, even like the environmental, whether it's putting your cell phone on your lap or in your pocket, so it's not only the food, but also the environment,
Okay.
so, and those are also things that I talk to my patients. And then also there's exhaust from the cars,
Okay.
so, or, heavy metals from God knows what,
Yeah.
water or food, so yeah, there is uh, more to that, but it's always like individualized again. So I don't know, so it, I have to talk to the patient to see, what they're doing. And then also their work history is
Mm-hmm.
huge. Were they in the military? Where did they grow up?
Okay.
Were there, so it's, yeah, there's always a story why
Mm-hmm.
the body is, I guess, misbehaving,
Okay.
for lack of words,
Yes. Yes.
So it's not one fit all, but yeah, definitely we're seeing a lot of, um, I guess, feminine type of, you know, I guess behaviors or,
Yes. Absolutely.
in men. But
Mm-hmm.
yeah, so, yeah.
Okay.
So, hmm
Yeah, for me, in December, I'm actually doing a estrogen detox for people who have excess estrogen in their bodies, especially like men and
Okay.
women. So I'm gonna do an
Uh-huh.
estrogen detox in December for 7 days. It's
Okay.
gonna be my first time doing it, so I'll definitely be reaching out to you for some help on that one.
Oh yeah, yeah, sure.
Yeah,
Sure. And
appreciate
then
it.
in women,
Hmm.
we, a lot of patients like come to me and they have like fibroids,
Yes.
So fibroids is huge, in the conventional way, which is, it's not, I wouldn't say it's a bad thing or good.
Hmm.
It's just that it's typically surgery, you know. But we see that fibroids is actually imbalance of hormones, especially like too much estrogen,
Yes.
So if we're not finding the source of where the estrogen is coming from, um, patients end up having like second surgery, a third, and so it's not, it doesn't quite fix the problem.
Mm. Okay.
Yeah.
All right.
hmm
Good, good. So a holistic
Yeah.
approach would be better for a person instead of getting cut open. See what the holistic approach is before you go that route. I would say.
So definitely, yeah, definitely. Naturopathic care is great overall
Hmm.
for your health, but sometimes the fibroids can be so large that
Yes. Okay.
even me as a physician, I can see that surgery is absolutely the best route.
Okay.
But patients can have surgery, but it would be better to work with a naturopathic doctor to really make sure that now we're preventing the problem to happen again. You
Hmm.
know,
Hmm.
so yeah.
Okay. What about
hmm
endometriosis? Do you find that you're seeing a lot of patients with a lot of women with endometriosis these days? Because I've known years ago it was huge. So how is that
Uh-huh.
now? How is endometriosis now? And does that play a part with the hormones as well?
Um, oh my gosh. So, endometriosis is one that's really hard to like uh, pinpoint, even conventionally.
Okay.
So, um, but I'm not seeing a lot of it in my practice.
Okay.
So maybe patients just go to, there are a lot of like drugs now that are out there that, the conventional doctors are using, so, but also, it does play a role, with your hormones as well. But I'm not seeing, a lot of, patients with endometriosis. But that one is hard. It could present with, weird, in a weird way, whether it's like, pain, pelvic pain, irregular menses, those kind of things. So, typically when patients come to me, they have, those symptoms. There are a lot of herbs or natural supplements that we can use, so either way they end up, responding really well.
Okay. Cool. Cool. All right, so we're going to transition over to weight loss now, because I am actually doing a 14-day weight loss challenge. And, as for you being a doctor who deals with weight loss, what is it something like sometimes psychological that happens with weight loss and weight gain? Is it a psychological thing? I was thinking about this today when I was in the car driving, and I was like, you know what, with the information that I'm giving the people that's in the challenge, everything is coming back to mindfulness. And everything is coming back to thought pattern when it comes to food. Can you elaborate on that just a little bit?
Yeah. Yeah. So weight loss, weight loss, it can be tricky. Obviously, I in my practice, just like anything else, I look at the emotional component. So why is it that patient is either gaining weight or they have a hard time losing.
Okay.
So definitely like there's like emotional eating, so I have to look at that one as well. But also there's a point where the patient is doing everything that they can, but their metabolism is just not, working as well.
Okay.
So it could be like their thyroid is either hypofunctioning or hyperfunctioning. It could be their diet. It could be that they're not moving, no movement, no exercising. It could be that they're depressed. It could be stress. Stress also can make you, gain weight.
Okay.
But so I try to see, I guess, where each patient is coming in from, and then also when your hormones are in balance, you have a hard time losing weight as well.
Okay.
So that's another component that I look at, but for the most part, it's best to address the mental and then the physiology.
Okay.
At the same time.
Okay. Yeah. So that comes to that conclusion where that, people really need to go, like when you hear like a trainer say, go to a physician and get checked before you start this program, that is very huge. That's a very huge statement.
Yeah. Oh, it's huge.
Yeah. Okay.
Yeah.
All right. It's all coming together. Yeah. Yes. Cause if a trainer doesn't know what's going on, then, and if you're not losing weight and you're doing all of these things, then, what's the point after that, besides getting that checked out and knowing?
Yeah, it's huge. It's huge because it could be, like we said, it could be a lot of reasons why you're not losing weight. Also, the detox pathways could be off too. Like, you might be burning, everything, but then, either your liver is not detoxing right, or, so there's always a reason why, somebody's either gaining weight or losing, but then they hit a plateau. you know?
Okay.
Yeah.
All right. Yeah. So So weight loss can
Yeah.
be really, really tricky at the end of the day. So
Yeah.
if you don't know all the components and everything that's going on
Yeah.
with the person. All right.
Yeah.
What recommendations or suggestions would you give to somebody who's just want to start a routine, a workout routine, or just want a weight loss? They just want to lose weight. Like what would be 3 recommendations or suggestions you would give them?
Um, so I would recommend to find um, a doctor who does uh, medical weight loss, because you will find that there are a lot of people out there doing, oh, I can help you drink this tea, this type of tea. You're gonna shrink your belly. All these things. So I would tell people, find a doctor, let them check out what's going on with your health first.
Mm-hmm.
If everything checks out good, then find somebody who can help you with the nutrition component. Which
Okay.
in your case, like if they could come see you, after they check with their doctors,
Yes.
So I would say just first find out if there's no medical condition that's contributing to the weight gain.
Okay.
Okay.
Mm-hmm.
And then after that, then find somebody like a health coach like you to work on the nutrition, and then go to the trainer to do the exercise, because everything kind of works, really well together. But if you start training, but then let's say your thyroid is not optimal, then you have a hard time losing weight, because
Yes.
your metabolism is off.
Mm-hmm.
So the best one, I would say, step one, go get checked, to find somebody who can help you with the nutrition and diet, and then do the exercise afterwards.
Okay. Good.
Hmm.
Good information. The other thing was
Yeah.
you said something about the teas and things like the detox teas. I
Uh-huh.
see a lot of ads. I see a lot of people promoting these detox teas
Uh-huh.
around. Like, what
Yeah.
would you recommend something like that to someone, or what are what's your take on these lose weight quick type of things?
Um, I see a lot, and especially with people like they have like big belly,
Mm-hmm.
you know. So typically, to me, the first thing I go to, I'm like, oh my gosh. I mean, is it a cortisol issue? Is it estrogen issue? Is it testosterone? Because when your belly is big, or is it that you're constipated, like
Mm-hmm.
your digestive system is not doing well. So
Mm-hmm.
doing the detox is almost like cutting corners,
Okay.
because it could be, there's a lot of reasons why the belly is big, so let's actually figure out what's going on. And then some of the detox teas have a lot of herbs in there. So if you're not familiar with how herbs work, then you're doing a lot of damage to those people, because they're when in my practice, and then also other naturopathic physicians, we learn about herbs. So herbs are, some of them are cooling or warming. So when we give a patient an herbal tincture or herbal supplement,
Mm-hmm.
we have to match with their constitution.
Yes.
So when you take this like detox teas, and you have no idea what the herbs, if they're contraindicated in your case, whether you can get pregnant, and then you're taking these things, they could be contraindicated in pregnancy, or even breastfeeding, or even when you're taking, other medications. So, it just looks like easy and fun, but I would just
Yeah.
caution,
there's no
people to,
there's no magic tea or magic pill that you could take, and you just have to put in the
yeah,
work, and it
yep,
takes time.
yep,
Yeah.
yep. That's exactly right.
And
Yeah.
it depends on your willpower. If you have great willpower, guess what? You'll lose weight quick. And
Oh yeah.
yeah,
Oh yeah.
if you have great willpower. So that's the determining
Oh yeah.
factor, folks. The willpower is the
Yeah.
determining factor to where
Yep.
you are trying to get with your weight loss
Yep.
program.
Yeah.
Yes, yes,
Yeah.
yes.
And to
Okay.
make sure that you to make sure that what I see in my practice is once we get a patient like a tailored treatment, they actually um, keep losing. Like they never go back to gaining or
Yes,
plateau.
yes.
So yeah, so that's why like when you do it right, your body actually knows what to do.
Absolutely. Your body will adjust, your
Yeah,
stomach will shrink,
we're just
yeah,
yep,
yeah.
yep,
And then they'll have the education after that to
right,
live a better lifestyle and to keep that weight
right,
off in the future. So
right,
excellent
right,
information. Excellent, excellent. I love it.
right.
All
Yeah.
right, so let's just go across the street over to sexual health now.
Yep, let's do it.
Yeah. So what are some of the things that people are talking about in sexual health these days?
So I'm seeing a lot of people with low sex drive.
Hmm.
Even though I was listening to like there was I think it was on radio or something, and they're saying that people are having more sex now because of the pandemic.
Hmm.
But I don't know. I I don't know if they're being creative by themselves, but what I see is that people are struggling with low sex drive, so libido, and that goes to hormones play a big role
Mm.
in sex drive. In men, especially testosterone is huge.
Yes,
It's
yes,
huge.
yes.
So if it's it's lower, or we have all these environmental things that are playing a role, and then that's not gonna uh, work. So yeah, so that's what I see, and then I see a lot of like vaginal dryness, and then women are even afraid to engage in any sexual activities just
Okay.
because of the pain and and stuff like that. So yeah, so there are a lot of natural treatments that we can do, for those type of
Okay.
situation.
And
Hmm.
most of those situations come back to food, right? And what they're putting in their mouths as far as their diet
Oh
is
my gosh!
concerned.
Oh,
Hmm.
it's huge.
Yeah.
Oh, it's huge. It's huge. Yeah. Yeah. If you're using microwave and heating the plastic containers,
Hmm.
those that we in my practice, I tell patients to get rid of that. We use, yeah, I encourage using glass, and then also the products, the personal, either hair or body products. I also look at that. It plays a big,
Mm.
huge role in hormones with both really men and women.
Okay.
So yeah, so that yes, that can affect your sexual function.
Hmm.
Yeah. Hmm.
What about marijuana? Does marijuana have anything? Can it affect your sexual appetite, or how you feel sexually? Can it mess with your hormones a little bit as well?
You know, there are a lot of like research they're coming out now. Because yeah, cannabis used to be, I don't know, it wasn't big topic, but now yeah, more people are learning about it. So um, I mean, I've heard where it can interfere with hormones, but I honestly need to keep up with the research and see what people are coming up with. Yeah, so I really haven't digged deeper to
Okay.
see, but yeah. But we know it can help with, with other conditions, pain and appetite, people with cancer. It's excellent when, with the chemo, they can't eat and, so it kind of helps with them, eating so they can keep the weight on, and not lose weight. And then with the nausea from chemo, so, kind of the overall can be helpful, but again, it depends on how people are using it,
Yes.
and then,
if they're abusing it and things like that.
Mm-hmm.
Absolutely.
Yeah. Mm-hmm.
All right, cool. These days now we see a lot of young men, taking male enhancement supplements, like Viagras and the different types of, drugs that are out there for, men who have these issues to take, not the men who don't have it. And I see a lot of younger guys taking it because they want to feel like they're more dominant in the bedroom. What are like the side effects of doing that on a continuous basis? Or, have you seen anything that can, any type of, situations where a guy took some male enhancement supplements and it didn't go in his favor, or, long-term effects? Have you seen any or heard anything about those issues?
And so how old are these people?
Like in their 20s, 30s.
Oh, their 20s.
Yeah, like their 20s and their 30s.
So they're probably just playing around then.
Yes. It's like more of like a party thing. It's not that they need it. It's more of a party thing. Yes, Les. They want to just feel that dominancy. Okay. Yes.
Okay. So typically, any drugs that enhance the sexual side increases your heart rate.
Mm-hmm.
So I would caution them to really make sure that they don't take any of those things, because they could do a lot of damage, either with their liver or heart, or even kidneys.
Yes.
So because I'm not sure what's in those
drugs,
supplements or drugs that they're taking, but I would and especially if they're taking other drugs or they have other medical conditions, such as asthma or so those kind of things. So you don't want to mess with that, but if they want it, there is a natural way to do it, and that I offer in my practice. Obviously not like in their 20s, because then we have to talk about the mental aspect, the mindset.
Yes.
But somebody in their 30s, 32, married, and they're just having a little bit of trouble, or they want to enhance, their sex drive. There are a lot of natural, more safe ways to do it.
Good. Yeah. Because these guys are out here these days. They're buying like counterfeit Viagras and Cialis, and it's coming from China, or people are traveling places and just picking up stuff and bringing it back, and that's that can wreak havoc on your internal organs. And they're not even getting checked. They're just buying it from somebody on the street, and they're not even getting checked. They're like, oh, my man, he sells Viagras, he sells Cialis. Go over there and buy it. And you never know what you're getting. That's even like marijuana these days. A lot of people don't even know what they're buying. They're just buying stuff to get high, and they don't even know what it is, a sativa, indica, what. They just buying it.
They shouldn't do that, because there are other natural ways to do that that are more actually effective, and they don't cause other issues. There are like peptides, there's PRP, so just using your own body to heal itself, those kind of things. So, yeah.
Cool. Dr. Jeannette, where are you located at? Like for the people that's listening, where is your practice located?
Oh yeah, sure. So it's 10601 North Hayden Road, I-108, Scottsdale, Arizona, zip code 85260.
Beautiful.
I'm in Arizona, and I do in-person telemedicine or telehealth.
There you go. Wow. So if anybody out here needs Dr. Jeannette's expertise and her assistance, please reach out. And like always, I will have her information in the show notes. So you can reach out to Dr. Jeannette if you just want to, do a consultation with her and just see where you're at and see where you're trying to go, so she can help you with the making a lifestyle change that lasts. Dr. Jeannette, it's been a privilege, and I thank you so much for coming on the show. I appreciate you. Yay! Dr. Jeannette is here. We did it. We did it.
Thank you. It's been a pleasure. I would love to come back, so, and we talk about more stuff, but this has been amazing. Thank you so much. And, Will do. We could talk off the air about, just a couple of shows that we could put together and talk about those different type of ailments or illnesses and get them out to the public. Okay. Yeah. That sounds
Dr.
great.
Jeannette. Thank you very much. Appreciate you.
Thank you.
Talk to you soon.
Have a good one.
You also. Talk to you. Bye-bye. Today's podcast was sponsored by TourmalineWellness.com. Tourmaline Wellness offers the highest quality vitamins and natural supplements. All of their products are produced in U.S. at FDA-registered CGMP labs. They offer free shipping on all orders over $100, and orders over $200, you can earn a free wellness consultation with LadybugNaturalSolutions.com. Hey guys, I would like to thank you all for stopping by to check us out today on Back to the Basics of Health and Wellness podcast, where I talk to Dr. Jeannette Musset, aka Dr. Wellness Scottsdale. To learn more about Dr. Jeannette, you can head over to her Instagram page at Dr. Wellness Scottsdale. All right, guys, until next time, continue to make the lifestyle change that lasts. Enjoy, everybody. Have a great one.